What's up, guys? And welcome to episode 18 of the Travel Like a Boss podcast. I'm here once again with Dr. Alexis Shields. Welcome to the show.
Thanks for having me again.
Yeah, so it's been a while, and I wanted to follow up with you and really having a whole episode just about health. Because it's not every day that we have the opportunity to sit down with a doctor, especially one that actually understands nutrition and health and really just pick your brain. So thanks for taking the time to do this.
No problem.
So what we actually did, so I've been eating paleo for the past, I don't know, maybe 7 or 8 months, and I feel great. I've lost weight. I have tons of energy, and common sense tells me, hey, I'm doing the right thing. But there's a lot of controversy out there about how much butter I should be eating, and that I'm not eating whole grains and all this stuff. So Alexis actually recommended that I go out and get all my blood work. So if you guys listen to episode 3, it's her and her fiance, soon-to-be husband, Dr. Shannon Weeks, and they both sat down, and on the show notes of that episode, you have all the tests that she recommended I take. So what do you have in front of you right now?
So I'm looking at all of your lab work. Some of the basically there's some really easy basic blood work that can tell you a ton about your health. And I think a lot of people are used to, we only go to the doctor when we're sick, and you get some basic blood work done. It all comes back either normal or close to it. And the doctor says, great, you have a clean bill of health, and you go home. But really, there is a ton of information that you can get from very basic blood work if you look at it in a holistic way.
Cool. So in today's episode, we're going to go over my personal blood work, and, I've never gotten it done before, so this is a little bit, fun, but it's also kind of scary. So we're going to go over that, and as well as we're going to have some questions that I put, I put a link on my Facebook, having Dr. Shields on the podcast, and a couple people have asked questions, so we're going to get to that at the end as well. So I guess first off, just kind of let everyone know what my diet has been is I haven't eaten any kind of wheat or like pasta or even rice really for the last, I don't know, maybe 8 months consistently. I've had, here and there I'd have a little bit, but when I say that, I mean I have sweet potatoes once a week, and I've had white rice maybe 5 times in the last 8 months, and I've had wheat maybe once. I'm not 1,000% strict, as in like once in a while there's a little tiny bit of breading on something. I'm not gonna, I don't completely avoid that, or things like soy sauce. There's still some of that in my diet, but I've really tried to eat, what they call paleo, or I follow the bulletproof, diet. So let's take a look at my blood work. What do you want to start with?
So let's start with the basics here. So blood sugar is the absolute primary thing that I look at when I'm looking at someone's diet, just because your blood sugar will tell you, or so many chronic diseases are caused from having poor blood sugar control. So your fasting blood sugar was 93, which is excellent. We like to see it between about 75 and 95. And then your triglyceride levels are usually grouped in with cholesterol, but I actually group them in with blood sugar, because what happens when you eat food is it turns into sugar in the blood so that it can be converted into energy. And if you have too much sugar in the blood, then it then converts into fat or triglycerides. Okay. So if you have way too much sugar in your diet, too many carbohydrates, then your triglycerides shoot up.
Okay. And so mine was right in the middle?
Yeah, right where we want it. Your triglycerides were 89, and we like to see them between 60 and 100.
Okay, nice.
So even though you're eating a very high protein diet, people will say, oh, that'd be terrible for your triglycerides. You're eating way too much fat, but your triglycerides are perfect, and your fasting glucose is perfect.
Thank you. And I eat a lot of fat. And for those who, haven't had the pleasure of seeing me digest half a cow, I actually purposely ate more butter than I would even normally before this test, because I wanted to, because that was the one thing that really worried me. It made sense. Dave Asprey talks about it in Bulletproof Executive, that if you eat grass-fed butter, that it makes sense to eat a lot. But it's such a controversial thing, because our entire lives people have taught us not to eat so much fat.
Right. So
I purposely ate. I actually went out and bought I think it was a 5 pound stick of butter, and I had that just last month.
It's definitely not affecting your triglycerides.
Okay.
The one thing we don't have here with you, though, is this is the first time you've ever had your blood tested.
Yes.
So we don't have a point of comparison. If we were to have tested you before you did your paleo diet, we would really see, is your blood test improving? Is it, we don't really know if it's improving at this point, and it very well could have.
Well, I'm definitely going to use this as a baseline and get retested again. Are you talking about once a year, every few months, or?
If you are really concerned with optimizing your fitness and your health, I would say at least every 6 months until things are pretty consistent, and then check in every 12 months. If you have some type of chronic disease, you really want to do it more often than that, every 3 to 6 months.
Okay, so I'll make a note for me to do it after 6 months and see where these numbers go. I would just guess that compared to my old diet, which was plates of spaghetti, KFC, McDonald's, things are improving.
Yeah. I'd be willing to say that. And your blood sugar shows it because it looks really optimal.
Okay. So no risk of diabetes from that?
No risk of diabetes.
Good.
On here. One other test that you could add in next time, sometimes some of these tests are hard to get in Thailand where we are right now. Hemoglobin A1C is a really good test to see what your average blood sugar is over the last 3 months. And you want to see that percentage is between 4.5 and 5, which would mean that your average blood sugar is around 100.
Okay. So as nice as it is getting your blood test done here in Thailand, because it's a lot cheaper and it's you don't really have to make an appointment, you can kind of just show up. I actually regret not just doing it back when I was in the US. And if they actually, we'll give everyone the details later, but if they actually go through you can order lab tests for them for a much cheaper rate.
Fraction of the cost.
Than even going through your own doctor with healthcare system. But so what's next on the list?
So next is kidney function. So there's 2 main organs that help you to detoxify the body, and they're super important to help basically get all the toxins out of your blood and your body. Kidney function looked really good. So when I'm looking at a blood test, I'm looking at, is it outside of the conventional lab range, and then is it also within my optimal range, which is 2 totally different things. To be within the optimal range is more concerned with optimal health. You could have a lab that looks completely normal, but I would still say that it's outside of my optimal range, meaning that you need to address that issue so that it doesn't become a problem in the future. So looking at your kidney function, everything is within the optimal conventional range, but there are 2 markers that are a little bit outside of my optimal range. Actually, mostly just one. The other one's really close. So uric acid is a little bit high. And in your case, I would say, we talked about this before, is that you were doing strenuous exercise and also lots of protein, like whey protein and that kind of thing, which it may have been, time to kind of go down on the protein intake.
Okay.
So your uric acid levels can go up a little bit when your protein levels are at a high amount. And if you're doing bodybuilding and that kind of thing, that's also always the risk, is you want to give your body a break so that it's not putting too much burden on your kidneys and your liver. Okay.
So I've actually recently decided, just the other day, I gave away all of my supplements. And it was really after hanging out with Alexis and talking to her about health, realizing that I really don't need a supplement as long as I eat healthy and exercise. And if I'm going to take supplements, I need to take the best ones and not just whatever I can find at Costco for the cheapest.
Yeah.
So at the end of this podcast, I'm going to ask you about supplements, because that was one of the questions that one of the fans had. But as for now, no more whey protein. I'm done with that.
Yep. I think eating your food rather than taking it in pill form is always preferred, or even in a smoothie form. It's you got to eat it first. So.
Okay. Awesome.
Okay, so on to the next part, liver function. I think basically what I'm seeing with kind of the underlying picture here is mainly this protein thing, is that you just didn't need quite as much as you were taking, because your liver enzymes can be a little bit elevated. Do you remember when you had this test, had you just done exercise beforehand? Or had you had a big CrossFit exercise or anything like that?
I got this done in the morning after a day of fasting, so I didn't do anything that day. But I think the day before I did some sprints.
Did some sprinting. So when you have muscle breakdown after exercise, that can artificially elevate your liver enzymes.
Okay.
And so they're not elevated within the lab range. Everything looks really good, conventional range. In my optimal optimal range. I'm just seeing that your total protein levels in your blood and globulin, which is another protein, and then your liver enzymes were just a little bit higher than my optimal range. All could be just from taking a little bit too much protein or having a big strenuous exercise the day before and breaking down muscle.
So how many hours or how many days before you do a lab test should you not do big exercise?
I would say 2 or 3 days beforehand. It's okay to exercise. You just don't want to do, a really big weight routine or CrossFit or something like that. Okay. It's okay to do those things, but you have to keep that in mind that it might, elevate your enzymes just a little bit.
Okay, makes sense.
Yeah.
Well, it's good to see that those are still in the normal range.
Totally within the conventional lab range. All right, going on to cardiovascular health. So this is one thing that we don't really have a point of comparison. And with cholesterol, you really have to have a kind of before and after type picture. So in 6 months, when you redo your blood levels, we'll know kind of what's going on here, because your cholesterol may have been really elevated when you had that really poor diet. Mm-hmm. Your total cholesterol is just a little outside of the conventional lab range. And your HDL is really good. HDL cholesterol is the so-called good cholesterol, although that's kind of a misnomer. All cholesterol is good when you need it. Okay. Cholesterol is super important for your brain and making hormones, and it's we can't live without cholesterol. It's how we make all of our vitamins and everything too. So cholesterol is good for us. We just want to have it in a good balance. The ways to raise your HDL cholesterol is to exercise, and your cholesterol looks really good at 64. Your LDL cholesterol, or the so-called bad cholesterol, is only bad when it's way too high. And yours is a little bit higher than I like to see it, but we don't really know how much of that LDL is good and how much is bad. And so there's this test called the VAP test, which they don't have available, unfortunately, here in Thailand. And that tells you how much of your LDL is this small, dense cholesterol that is associated with heart disease, and then how much is this large, fluffy LDL, which just helps bring cholesterol out to the body to help repair. And so we don't really know that with this test, but this is something cardiovascular wise I would say definitely want to track on a to see what the continuum is. Okay.
And definitely when I'm back in the US, definitely to do the VAP test. I asked for it out here and unfortunately it just wasn't available.
Yeah.
A lot of people talk about the I don't know, I guess the LDL, HDL difference or percentage, or I don't know what the term is for that.
There's ratios of cholesterol, to HDL. And I like to see the cholesterol HDL ratio under 3.1. And that ratio definitely, if it's really elevated, it can tell you a lot of things, not just that you need to be on cholesterol medication. Really, you need to take a step backwards and say, what is going on that's making my cholesterol rise? Is it that I'm eating way too much sugar and so I'm causing a lot of inflammation in my body? The reason why that would be an issue with cholesterol is that cholesterol is kind of like the duct tape of the body. And when you have damage somewhere in the body, then cholesterol is produced to help repair the damage. So the problem's not the cholesterol, the problem's that you need repair.
Okay. And I know there's a, common wisdom says that, having a low cholesterol diet prevents heart disease. Is that true?
You can actually have too low of cholesterol, and too low of cholesterol can predispose you to things like cancer and dementia, and there's a whole other host of things. And so there's kind of like this, this sweet spot that you want to have good cholesterol that's about 150 to 220 is kind of my optimal range. But some people just have higher requirements of cholesterol overall. It depends what your stress levels are. Stress level, when it's high, you need more cholesterol. So I think it can be too low, and I've had a lot of patients that have come in and said, I have really, really low cholesterol. It's 110 or 120, and my doctor said I'm going to live forever, and that's definitely not true.
Okay. So in my case, you say it's not terrible.
No, it's not terrible. I think we need more information, number one, and we need to know, this could be much better than what it looked like before. And so that, I think we need to, we need to redo it in 6 months so we can see what we're looking at here.
And hopefully the next time I can do the VAP test.
Exactly.
And really get good numbers. Okay.
Exactly.
Cool. But let's say I wanted to start working on it right away. Is there anything I can change about my diet or overall health to just even steer it towards the right direction?
I mean, you're actually doing the best thing you can possibly do, which is to eat a diet that is based on healthy fats, healthy proteins. You could increase your vegetable intake, which will give you more niacin and nutrients that help with cardiovascular health. Okay. So yeah, you're doing exactly what you need to do, because what causes cardiovascular disease is eating too much sugar and processed foods.
Okay. So continue to not eat sugar, processed foods, which includes things like bread.
Yeah,
and
anything
pasta.
turned into a flour, bread, pasta, white foods, white potato, rice, anything that turns into sugar immediately after you eat it.
Okay. I know most people, they hear that their cholesterol's a bit high, they would automatically stop eating butter.
Mm-hmm. No, yeah, I think it's just not. Cholesterol is only responsible for about 20%, or diet is only responsible for 20% of your cholesterol number. And so you want your overall health to improve, and that will improve your cholesterol as well. But taking out one food like that is not going to even touch your cholesterol.
Okay, so definitely don't go on a low-fat diet.
No low-fat diet for you.
Okay, cool. That's good to hear.
Yeah, there's two other cardiovascular markers that you had that are inflammation markers, C-reactive protein and homocysteine. And both of those markers are really low, and so when those markers are high, then that puts you at a lot of cardiovascular risk, and yours are excellent. So
that's really good to hear.
Yeah.
I never even heard of inflammation until a few years ago. There's actually a guy I met doing jiu-jitsu named Ben Finnegan from Santa Cruz that first mentioned it, and I almost honestly, at first I thought it was some kind of hippie BS, inflammation, come on, like I never heard of that. I'll just take some ibuprofen and lower it.
Uh-huh.
And but when I started really looking into it, I realized, you know what? When I eat a lot of wheat, flour, bread, I start feeling kind of puffy, and I guess that's inflammation, right? And
yeah, totally.
And I just wouldn't feel healthy. So now that I cut that out, it's good to see that on my tests, it shows, hey, whatever I'm doing is lowering my inflammation.
Yep, exactly.
What are the downsides of having high inflammation in the body?
Well, the downsides is that inflammation is kind of behind all chronic disease, whether it's, the top diseases that end up killing someone in the U.S. is cardiovascular disease, diabetes, liver disease, kidney disease. All of those are diseases of inflammation. So if you can eat a diet that's anti-inflammatory, eat a diet that's low in sugar, you're going to do a lot in preventing chronic diseases like those.
Okay, awesome. Thanks.
So the next section, we tested your thyroid. Your thyroid looks optimal, looks wonderful. There's a couple different things when you get your thyroid tested. Often it will just be one marker, which is TSH, but you really want to know TSH is just the molecule in your brain, or the hormone in your brain that's telling your thyroid what to do. You actually want to know how much hormone your thyroid is producing, which is a free T3 and free T4 markers, and all three of those are in perfect range for you. So thyroid disease might be something, if someone is having a really hard time losing weight, hard time with motivation, hard time getting up in the morning, or a hard time with energy, that can be all a thyroid issue.
I used to think I had a thyroid problem, and it was always hard for me to lose weight. I'd always be tired, and I really was going to go to a doctor and say, hey, can you give me some thyroid medication? And I'm really glad that I first changed my diet and changed my exercise, and really my lifestyle, and before doing any of that, because I don't have the test from it before, but is there a chance that it used to be worse and now it's perfect? I mean, now it's in good optimal range.
Yeah, totally. In fact, a lot of people, when they come in to my office, they'll have a list of problems, or when I'm Skyping with them, they'll have a list of problems that they want to fix, but the primary thing they need to do first is actually improve their diet, because a lot of problems that show up either on blood work or that they're having symptoms of will be resolved just by changing their diet. So it's very possible that you had really low thyroid function, but then improved your diet and your lifestyle, and things turned around.
So for the people that are really overweight and they claim they can't lose weight because they have a underactive thyroid, what would your recommendation to them be?
Well, you got to start with diet, but weight loss is not all about diet and exercise. Some people truly do have low thyroid function and need to be on thyroid hormone. And as far as medications go, thyroid hormone is one that, in my practice anyway, has been very useful. It doesn't mean that someone needs to be on it forever, but some people do truly need to take thyroid hormone. With that said, a lot of times a thyroid issue is an adrenal problem, and your adrenals are little glands that sit on top of your kidneys, and they help you deal with stress. They produce cortisol, and because we're in kind of a chronically stressed out environment, and our bodies were never designed to experience that much constant stress, a lot of people need help with those little glands. And so there's a lot of nutrients and things that you can do to help maintain your adrenal glands, namely protein.
if you guys at home want to do a test, there's 2 tests you can do at home that if you listen to episode 15 with Dr. Shannon Weeks, he gave 2 tests that you can do at home right now to see what your adrenal function and overall health marker is. So, great advice about the thyroid. So to kind of sum that up, it's if you think that you have a hard time losing weight, first change your diet and exercise. Second, go out and get your actual test, the numbers, and then third, if talk to a doctor about it before you just go out and order some thyroid medication, right?
Yeah, definitely. Definitely. One lab marker that we wanted to have done, but something happened with the lab and it wasn't able to get done, was vitamin D, which everyone should have done at least once a year. And the preferable time to do it is kind of before you go into winter, because you want to know what your vitamin D status is before the months come when they're a little bit darker and you're not getting as much sun, because that's how you get vitamin D. So next time you get your labs done.
Well, unfortunately what happened was, so I had paid for it, got it done, and for whatever reason it got exposed to light and they had to either redo it again or refund my money. And I said to him, I was like, just give me a refund, because it would have been a bit unfair, because I had just got done tanning for 2 weeks on a beach in Cambodia. And I figured, let me test it either during winter, or let me just supplement vitamin D anyways, which we'll talk a little bit about later, because that's a big question that people have. Mm-hmm.
All right. Moving on to your immune system. So we also tested your white blood cells and red blood cells, so your ability to carry oxygen around your body, and then also your ability to fight infection. And all of those levels were totally within optimal range. And then the last test was...
Well, actually, before we go on to the last one, so I've always been worried that, I feel like I get sick a little bit more often now than I did as a kid. Because I used to pride myself on never getting sick. And even though it doesn't happen that often now, and it could be a variety of factors. It could be because I travel a lot and I'm always on airplanes. But, can you tell us a little bit more about that test?
Yeah, so it's actually good to get sick every once in a while. And people think, oh, I never get sick, I must be so healthy. But really, to have a really good working immune system, you want to get kind of a cold that doesn't last very long. It doesn't put you out for too long. It lasts 2 or 3 days and then you're back at it. You want to have that happen a couple times a year, because it's like an exercise for your immune system. So when we're looking at white blood cells and red blood cells, we're looking for iron deficiency. If somebody that maybe is completely wiped out and fatigued might have an issue with iron. You can also see if your need for B vitamins are increased. And then you can also see what parts of your immune system are functioning too much or too little. So you have different parts of your white blood cells that fight bacteria and viruses and parasites. And so if those are elevated, then you can see that you have one of those issues going on.
Okay, awesome. So while we're on the subject of the common cold, so the theory is if you go outside and your hair is wet and it's cold, you'll catch a cold. What is the official standpoint on that? Because I know I see all these science articles saying no, that's untrue. That that has nothing to do with it. But at the same time, common sense tells me that if your hair is wet and you're riding on a motorcycle at night and it's and you're cold, you lower your immune system and you're more likely to get cold.
Yeah, anything that you do that puts stress on the body can effectively lower your immune system and your ability to fight off infection, and so, or just exposure to viruses and bacteria. And with traveling, and a lot of people that are probably listening to your podcasts do travel a lot,
I hope so.
Including yourself. And it exposes you to a lot more than you would be exposed to just maybe staying in one place and being at home. So yeah, I would say anything that puts added stress on the body can lower your immune system. So you want to do things that can increase your immune system. One thing that I have people do before they get on a long flight, just because you're in an enclosed space for such a long period of time, is to take a high dose of vitamin C, which I don't have people do every day. A lot of people just take vitamin C, over the long haul to help increase their immune system, but really it doesn't work that way. You want to take vitamin C in short stints, kind of like before you get on a flight. You take a lot of vitamin C and it acidifies your tissues, which help to decrease the ability of getting a virus or bacteria.
So I just gave away my Kirkland signature 500 count vitamin C pill.
Yeah.
Not realizing that maybe it wasn't the best quality, surprisingly, because it was $8, so it's quite a bit of money, right?
Sure.
For 500 pills, that seems like a reasonable amount. Honestly, part of me always knew, this tastes too good, and it's way too cheap for this to really be good for me. So what was your reason for me to stop taking the Kirkland stuff?
So real vitamin C that occurs in food is it's 8 to 12 different things. It's a complex. It's not just ascorbic acid. And when you go to the store and you buy vitamin C, most likely you're buying ascorbic acid. And so when you take one isolated nutrient like that that's been isolated in a lab, it's not coming from food, it's a synthetic vitamin. And when you take something like that over the long period of time, you deplete a lot of other nutrients in your body. So, it's something that has use, but you only want to use it when it's indicated, which is, you're going on a long flight or you're feeling a cold coming on, so you take a big dose of vitamin C to help acidify your body, that kind of thing.
Okay, and what is that made out of, the stuff at Costco?
Ascorbic acid, it's isolated probably from different vegetables. I don't know. I think ascorbic acid usually comes from corn. Possibly they could also get it from soy, but I think it's mostly from corn.
Right.
And so
if I'm trying to avoid, GMO corn and soy, I probably shouldn't be taking this every day.
Yeah, probably not. Okay. Not a good idea.
Is there a different brand that is actually vitamin C, or can I just eat lemons, or what should I do?
Yeah, you can find, if you have access to things like Whole Foods and things, they'll have whole food sourced vitamin C, which would be on the label. It wouldn't just say ascorbic acid, it would say whole food source vitamin C, and then it'll tell you what vegetable they get it from. So yeah, those are a little bit harder to find, but especially when you're traveling, but you can find them in the US. Yeah.
So what if I just wanted to eat a couple of limes because I feel like I'm going to go on a flight soon, or I'm getting sick? How many limes do I have to eat?
I would say you don't really need to worry about the milligrams that you're getting. You just want to focus on eating high vitamin C foods, and really green leafy vegetables are where you get a huge amount of vitamin C. A lot of people think it's only citrus fruit, but it's in all vegetables. So if you're feeling like you're coming down with something, I would just, at every single meal, including breakfast, eating vegetables.
Okay. So would broccoli count as that?
Yeah, broccoli, high in vitamin C, anything green.
Spinach,
kale, peppers. Bell peppers have a ton of vitamin C. And citrus too. And
could it be cooked, or do these have to be raw?
Cooked is fine. Yeah, okay. Cooked is definitely fine.
Okay. And if I wanted to have, let's say I squeeze a lime in a glass of water, is that going to be a big dose of vitamin C?
Yeah, that's great. It's a great thing to do, especially for your liver. There's different nutrients within lemons, especially that if you squeeze that in a glass of water, it really helps to filter out your liver and helps decrease liver enzymes.
Okay. Well, one cool thing about Thai food in Thailand is they always give you some slices of lime with your meal.
Yep.
And I don't generally put it on my food just because I have a different taste. I don't want everything to be sweet and sour. But I always squeeze that lime into my water.
Yeah, it's a great habit to get into in the beginning of the day.
Okay, great. So let's move on to the next test.
So the next one was testing your urine, and everything looked absolutely normal. The one thing that came back in urine that was kind of outside of my optimal range is the pH of your urine. So you want the pH of your urine to be between 7.2 and 7.8. And my guess is yours was a little bit on the acidic side, meaning that your body's a little bit acidic. And so I think that's probably coming from just taking large amounts of protein, doing the whey protein. You just didn't need that much, and so it was showing up there.
Okay. I know there's a diet out there. I think it's called the Gracie diet, where they try to get everything alkaline.
Yeah.
Is there some truth to that?
Yeah, a lot of people think if you eat protein that your body's going to be acidic, but that's not really how it works in your body. It's just when you're eating really large amounts of protein, then you can become more acidic. Really, what you need a balance of all foods, and things that make you super acidic is sugar. Sugar, white foods, breads, pasta, that makes your body super acidic. You don't eat any of those things, and so I'm guessing that it's coming from protein.
Okay. I think a lot of people listen to this. I mean, hopefully you guys are really just following along and listening to it with an open mind, because I know a lot of this goes against all conventional wisdom. It goes against the food pyramid and the FDA, USDA, all that stuff.
Yeah.
And I don't want you guys to just pick and choose a couple of things out of there saying, oh, you know what, his cholesterol's a bit high and he's, you know, he has too much protein. The paleo diet is bad. I'm going to continue eating my whole wheat bread and, you know, low fat margarine.
Yeah, you know, I look at lab work all day long. That's what I do for work, and so I see patterns over time of different diets. I see, you know, the patterns of blood work from my vegetarian and vegan patients, and patients that follow, you know, specific diets, patients that follow paleo diets, and then standard American diet, and really patients that follow a paleo diet, which paleo is just kind of the fad term that it's called now, but really it's just eating real food and eating the way that our bodies have been designed to digest for thousands of years. When you follow a traditional diet like that, your blood work really improves. And so the patterns that we're seeing here, we're pulling out some, you know, kind of things that you can tweak to make them better next time, but everything looks wonderful. And from the, you know, the old wisdom of don't eat fat and don't, you know, you're eating too much fat, too much protein, that kind of thing, your labs don't reflect that at all.
Okay, so that's really, really good to hear. Just to re-emphasize with everyone out there, okay, if I started eating, let's say like a low calorie, low fat diet, would that be better than my current diet?
Definitely not. Your blood sugar handling would definitely not be as good as it is right now. Your triglycerides and your cholesterol might very well go lower, but the longer you continue with that diet, it could get too low to where you're at a risk for cancer and that kind of thing. So yeah, definitely not. I think you're on the right path, and your blood work in the next 6 months will definitely reflect changes and improvements.
Okay. And let's say I went on a strict vegan diet, ate nothing but tofu and quinoa and, you know, whatever other super grains they have, would that be better?
You know, with a vegan diet, it's really difficult to get enough nutrients and protein without supplementing, and so it's a very unnatural way to live, basically. And so a lot of vegans can do it for a specific amount of time, and then all of a sudden their health really starts to decline. And so I think, you know, you can have a healthy vegetarian based on the person's body makeup. Some people can get along being vegetarians if they're a healthy vegetarian and they actually eat vegetables and they actually eat proteins like fish and eggs. But a lot of vegetarians are junk fooditarians. They just like to call themselves vegetarians because they don't eat meat. And so you have to figure out what that means, because it's different for everybody.
So my current diet is better than if I was a vegetarian and I ate whole wheat.
Definitely.
Brown rice.
No
tempeh.
question.
Okay. That is awesome to hear. Really, like, this is such a big relief, because I felt like I'm on the right track and I feel like I'm healthy, but all the time, and I actually stopped talking about my diet and nutrition with my friends and family and really anyone, because I realized it's like talking to someone about religion.
Yeah, it is.
And, you know, the thing is, there's so much misinformation out there. And the craziest thing is the people that always argue with me about nutrition are the people that really are not in good shape themselves. You know, either they're very overweight themselves, or they look sickly and weak and pale, and they, you know, and they look like they're going to collapse any second.
Yeah.
You know, and I just stopped talking to everyone about nutrition. So I'm glad we had this podcast episode, because the next time someone asks me about my diet, and they ask me why I'm putting so much butter on my vegetables, why I'm eating so much fat or so many eggs, I'm just going to refer them to this episode. and that's it.
Yeah, I mean, the proof is right in front of us. Your labs look really good, and, you know, you can't really challenge the way that you feel compared to how you did when you had a standard American diet, and you can't really challenge having really good, you know, lab work. You can't challenge that.
You know, I got the blood test done, so if you guys want to challenge my diet or the paleo diet, go out, get your blood work done, and we'll compare. And you know, but the thing is, I'm not going to be, you know, just cocky about this and think, okay, now I'm perfect, I'm just going to continue doing what I'm doing. I'm going to take this advice that Alexis gave me, and I'm going to eat even more vegetables. I'm going to stop taking whey protein, and I'm going to get tested again 6 months from now to make sure everything continues to move in the right direction.
Yep, exactly. And then there was a few other tests that you had done. You had EKG, which tells us about the electrical conduction of your heart. And it said on here, which is like a medical term, that you have bradycardia, which means that your heart rate was lower than 60. So it was 58 beats per minute. And that actually happens, the resting heart rate lower than 60 beats per minute will happen in it will happen normally in someone who's in very good cardiovascular shape, because your heart essentially just becomes more efficient at pumping blood throughout the body, so it doesn't have to pump so many times.
So I have a low resting heart rate.
Yes, a lower than 60, which is 58, which is still very normal.
Okay.
You had a chest X-ray done, and the size of your heart is normal, and your lungs looked normal, so everything was a clean bill of health there.
That's really cool to hear.
Mm-hmm.
Any other tests?
You had a PSA, which PSA, CEA, and AFP, which are basically just all markers for different cancer markers, and so they included that in your package here, which I normally don't do, but they're different markers that in certain cancers like thyroid and liver, lung, breast can go up, and all of yours were in a normal range.
Okay, very cool. Was there any test that I didn't get done that I should have?
So vitamin D was definitely the big one, which you tried to get but couldn't. And then hemoglobin A1C is something I would definitely do. I didn't see that your electrolytes were tested, so they must include that in a different type of panel here in Thailand. And other than that, I think you did pretty much everything that I would have done on kind of a basic screening of someone who is generally healthy.
Okay, awesome. So for those at home who want to get tested, if you go to the Travel Like a Boss podcast.com episode, episode 18, in the show notes, you'll have a complete list. But honestly, it's just easier to go through, Alexis, because when I got tested through the hospital here, they gave the results, and they said everything's normal.
Yeah, which is usually what happens is, everything's fairly normal, so they give it back to you, and there's no explanation as to, is everything really normal, or are there things that you could do to improve your health, and it's on its way to not be normal anymore.
Yeah, so definitely, just sitting down this last 40 minutes, going over each individual one versus me looking at the number and Googling it myself and trying to figure out what this means, it's been invaluable. This is like, how often in the US or anywhere else can you sit down with the doctor for almost an hour and have them actually go over exactly what the tests mean, but also talk about your diet and get to know you and give you, good sound advice on what you should be eating and how to change everything. So,
thanks.
Yeah, thank you. All right. So if people at home, let's say they live really anywhere in the world, I guess, how can they get in touch with you, and how can they get these tests done, and how can they get the results?
So my new website just went up, and it's Dr. Alexis Shields, SHIELDS.com, and I have some basic packages on there for new patients, and one of the beginning packages is to do exactly what we're doing right now, which is to go, somebody gets their lab work, I can coach them into what they need to have done based on their health, and then we go over the lab work, and I give them suggestions for optimizing their health and their fitness, basically. So that package is on my website if you click make an appointment. So if you're in the US, unfortunately I can only do it in the US. I have a lab that I contract with to get really cheap labs, a fraction of the cost of what they would be.
If someone walked in by themselves to a hospital and wanted the lab tests done, how much would that blood work cost?
The package that I have most of my patients do is, I would say, between $1,000 and $2,000 worth of lab work if you were to pay the true cost, but the cost to us is about $225 to $250. So yeah, it's definitely
even
cheaper.
If they don't have insurance.
Even if and to get the cheap price is actually a cash pay lab. To go through insurance, super expensive.
Okay, wow. So that's a huge savings. And I absolutely, wholeheartedly, I recommend to every single person listening to this, they get your lab test done and you sit down with the doctor like Alexis, and they can do it through Skype with you, right?
Oh yeah. Yep. I do most of my consults over Skype, which it's really easy to do over Skype.
I really could not recommend this enough. If anything, I would recommend, you even buy this package for someone's, birthday or Mother's Day, anyone that you really care about and you really care about their health. to have them get these tests done, because I wish I had these tests done, every year prior to this, so I can track my progress. And you bet I'm going to be continuing to test at least every year, if not every 6 months from now on, because this is so important.
Yeah, you really want to start the earlier the better, because then you can see this continuum of what your health and your labs are doing. Because if you see something that's continually getting worse and worse, even though it's still within the conventional lab range, you can catch it early and reverse it. Whereas when it becomes a problem, it's a lot more expensive.
Yeah, and I'm glad that, even though I've been feeling healthy, that I went out and got these done anyways.
Yeah.
It was just really perfect timing. And it's actually not any cheaper to get it here done in Thailand. I thought it would be, and I think for a very basic package, it would have been really cheap. I think it was about $150 for the basic package. But by the time I added on a lot of the other things, it was actually closer to $350. So through Alexis per hookup, basically, you can get it cheaper, even if you're in the US, than in Thailand, which is amazing. Yep. Which is really, really cool. So before we move on, I want to take a look at all the questions that the fans had asked. All right. And this is kind of a fun thing, because really these are questions that I'm sure a lot of you guys listening have in the back of your mind as well. So let's take a look to see what we have first. So Bruce Chen from Taipei, Taiwan, he wants to know what you think of TRT, which is testosterone replacement therapy, the pros and cons.
So I'm not for testosterone or against testosterone replacement therapy. I think the problem becomes when, a man that is 60 years old, for example, if we're just talking about guys here, because women also have testosterone, but the general TRT is applying to men. So a man of 60 years old is going to have a lower testosterone than a man of 20 years old. That's just normal physiology. And I don't think that we need to change that. It's normal. Actually, after about 30 years, I think it's around 30 years, testosterone starts to decline. But there is normal ranges when you are, 60, 70, even, 40s and 50s. And so if you get your testosterone tested and it's too low, a lot of people will just jump to, I need to then take testosterone. But there's so many things that you can do to raise your testosterone without having to take a hormone. And a lot of people are missing the biggest issue, which is, why is your testosterone too low in the first place? And taking a pill isn't going to fix why it's low if you don't address those things first. So there's things like losing weight. Losing weight will definitely increase your testosterone. Exercise, doing high intensity burst exercise will increase your testosterone. Intermittent fasting, which is something that there's a lot of information out there about now, which doing short periods of fasting a couple times a week or every day. You only eat during these certain hours, like from 11 a.m. to 7 p.m. kind of thing. And so you have a longer period of time where you're not eating. That can increase your testosterone. So there's so many things you can do before you just jump to hormones. There are some people that do need to be on hormones because they're experiencing symptoms that have not been helped by all these other interventions first. But you want to start there.
I firmly believe that 99% of people thinking about TRT are looking for a shortcut.
Yeah. There's just not a magic bullet, and you're not gonna be satisfied by just doing that if that's not the issue.
I've seen people who genuinely need TRT, and they are super effeminate, and you can just tell this guy really needs, he really needs testosterone. There's
times when it's definitely useful, but you really want to start with, why is this happening first, and use that as the last resort.
This is a bit private, but I don't mind sharing it because it really helped me. About a year ago, I felt like my testosterone was getting really low. Mm-hmm. I think I was 31 years old at the time, and I was losing muscle mass. I wasn't sleeping as well, and my sex drive just diminished. It was just gone. Mm-hmm. And I really considered getting TRT. I mean, I looked into it. I even spoke to a doctor that, basically it was like a doctor hookup where he was just going to write you a script for it.
Mm-hmm. Yeah.
And, I really thought about doing it. Because I was thinking, this will help every part of my life. I'll be in better shape. I'll be leaner, more muscular. My sex drive would go up. Everything would be great. And I think the only 2 reasons why I didn't want to do it was 3. One, I didn't want to have to, use a needle in my butt every week. Second, it was pretty expensive. And, third, I didn't want to lose any more hair. And I decided after that, I was like, you know what? Let me just give this a shot naturally. So that's when I started doing CrossFit. That's when I started eating paleo. And I'm very happy to announce that, a year later, I haven't tested my my testosterone levels, and maybe that's something I could do.
Yeah, you could definitely do that next time.
Okay, I definitely will do that. But I can feel it. I mean, I can feel I'm losing body fat. My I'm really lean and muscular, and my sex drive is higher now than it was when I was 18. So, the diet exercise works. Stop taking shortcuts and just go out and do it.
Yep.
All right. And so on the same subject, HGH, human growth hormone. What do you think? What are your thoughts on that?
I mean, it's exactly the same. It's just someone looking for a magic bullet or a pill that's going to, solve all the problems in your life. And it's just never that easy. Even if things may improve over the short term, it's just not it's not sustainable in any way, shape, or form. And so I've had a lot of people that I've seen who have done HGH, and it's just, in the long term, it's not a sustainable change to make.
Okay, so guys, stop trying to take shortcuts because there is no biological free ride.
No, there isn't.
All right, well, the next question is from Kenneth Liu, and he's from Kuala Lumpur, Malaysia. And he wanted to ask what the benefits are of superfoods. How super are they actually?
They're very super. Superfood in other parts of the world is just called food.
Okay.
I think this is kind of along the same lines, is that there are food, when you refer to a superfood, it's a food that's very nutrient rich and it has a lot of health benefits. And so to me, superfoods are, not the most rare fruit that you can find deep in the Amazon. They're things that we have available to us every day that if we ate, our health would improve, our blood work would improve, we would live longer, and we'd have less chronic disease. So my definition of superfoods are very different. I don't have the magic bullet superfood that if you ate this, all your problems would go away. I wish that happened. If it does at any point, I will let you know, but it's just not the way that health works. So some of my main superfoods are eggs. Eggs get a bad rap for being high in cholesterol, but we need cholesterol, and healthy eggs from healthy chickens are super rich in good fats. They're actually have a really optimal ratio of omega-3 to omega-6. And in the standard American diet, we get way too much omega-6. And so it's a great way to get omega-3s. The other thing that eggs have, which hardly any other foods have, is they have some vitamin D. Which you don't really get in food sources. So it's definitely, eggs are a really nutrient-rich food. I like to call them, they're like little multivitamins. I'll give you a couple more. Another one that I love is kale. Kale is super rich in nutrients. Any dark leafy green really is. Great nutrients for your eyes, great nutrients for your immune system like vitamin A and vitamin C to help fight off bacteria and viruses. And you can put kale, in smoothies. You can make kale chips out of it. You can put it in salads. You can eat it raw. You can eat it cooked. It's a really good food. And then, let's see, what is some other... Avocados are a huge superfood. Avocados and coconut, which we can get readily here in Thailand. Avocados, actually, if you're trying to gain weight or gain muscle mass, avocados help you to increase your absorption of fat-soluble vitamins. And so it's kind of like you're increasing your nutrition in the meal that you're eating just with eating avocado. And then the last one is coconut. And coconut is a saturated fat, so people are really anti-saturated fat. But it's super healthy for the heart. And it's like the medium chain triglycerides, and that it's a direct fuel source for your liver. So nice. Super good. And also coconut has a lot of lauric acid in it, which is antiviral, antibacterial, and antiparasitic.
Nice, and it tastes great. I love coconuts.
Yes.
Sometimes I've been eating up to 4 coconuts a day. both drinking the water and eating the meat of it. Is that too much?
No, I think if you're eating, good coconuts, especially when, it's different for us because there's coconut everywhere. In the US, it's a little different because they have to go such long distances, and so it changes the composition of the nutrition. But here, because they're so readily available, I think there's nothing wrong with that.
Okay. So what about coconut milk?
Coconut milk has all the good, healthy fats in it. A lot of people actually will supplement, not the coconut milk so much, but the coconut oil as kind of one of their general supplements throughout the day. Is they'll do a tablespoon of coconut oil. Coconut milk is excellent, though. Okay,
awesome. So one thing I've been doing is I've been adding avocado. So I have a couple of rules in life. One is anytime I come across a fresh coconut, I have to have it. And it was really difficult in Cambodia because every restaurant I went to had fresh coconuts, and it was usually about $1. So instead of drinking water, I would just have coconut. And every street corner had a coconut as well. So, being out here, I mean, this is one of the big reasons why I've decided to change my life and be able to live in places like Thailand and be able to travel to places like Cambodia, because I know it's so beneficial to my health.
Yeah.
So if you guys are stuck at home, in your cubicle, and you're complaining about not having access to these foods.
Yeah. Or drinking coconut oil out of the box or coconut water out of the box.
Yeah, and it doesn't taste
sugar
good.
In it.
Yeah. I mean, a lot of them don't have sugar. Like nowadays, a lot of them don't have sugar.
Yeah.
But they just don't taste as good.
Yeah.
Like
not as fresh.
And they're expensive. Oh my God. If you go to a Whole Foods or even just a normal supermarket in the US and you buy like Zico or whatever other coconut water brands there are, they're usually like $3 per container.
Yeah.
Sometimes I think it's like $5 sometimes. And it doesn't taste good. If you've had fresh coconut, I mean, last week I had a guy climb a coconut tree, bring me down a coconut. And said, "Here you go," and it was $1. And I was like, and I felt bad for a second. I'm like, I can't. Like, there's no way you could pay me $1 to go climb a tree and risk my life. But I'm really glad that it's here. So my other rule is anytime I eat out at a restaurant and they have avocado available, I always add it as a side, no matter what the cost is. And, sometimes they charge you, I mean, luckily out here, they normally don't charge you more than $1 or $2 to add it. But even if they charge me $3 or $5 to add it as a side to my dish, I have made it a rule that because it's healthy and I know it's good for me, no matter what, I will add it.
And it's a great healthy habit that you can get into doing in the States too, because a lot of people will say, well, when I go out to eat, what are my options? And you just have to get creative. And, you go out to breakfast and you get an omelet, add some avocado.
Or guacamole.
Yeah.
All right. So if you guys, are worried about the cost of that, really ask yourself what is important in my life. Make that your resolution for the next year. Say, no matter what it costs, I will buy get avocado on the side. If I have to make more money, I'm gonna figure out a way to create more income online, or grow my business so I can afford stuff like that, or cut out the other stuff, that things that aren't as important. So make that your priority. So I think Kevin's actual question was more about superfoods, as things like acai berry, or what are some of the other ones out there that people say?
It's usually like amalaka fruit, and it's a lot of fruits and berries that are really high in antioxidants. And I think that, increasing your antioxidants and increasing your nutrient-dense food and things like that, as long as, it's usually it's a marketing campaign, and it's, if you take this thing, then your health will drastically improve. And I think, for a lot of people who don't have a very good diet, or they're coming from a place of, having little access to different foods that are healthy, that it can be something that can really improve your health. But you want to really kind of put aside the marketing campaign and think, am I thinking about my diet first and then supplements later? Because supplements are only, supplemental to a good diet. If you're just taking supplements, or you're just taking these, amazing superfood drinks or chocolates or whatever, it's not going to do anything for you if you don't already have a good diet. So
stop taking shortcuts.
I think
but
that's the theme.
Things like dark chocolate, high antioxidants.
Sure.
How dark does it need to be to justify eating?
With anything like chocolate or coffee or things like this, you really want to get the highest quality possible, basically. So the darker the better, basically. I don't know if there's any percentage that comes to mind that it should be. It should just be dark chocolate, not milk chocolate. Okay. And then, the highest quality possible.
But do be careful, because some brands like Nestle and, Mars or whatever, they started making dark chocolate that's actually only like 51% chocolate.
Yeah.
Because it tastes good. They load it up with sugar, and people eat it because they're like, oh, it's good for me.
Yeah.
So I would recommend something 80%, 85% or higher.
Definitely.
And work your way up as well. I mean, it's. I'm still floating around the 85% range, but I'm trying to get to 91.
Yeah. I mean, and what I mean by high quality chocolate is that Nestle and all of the, the candy bar chocolates, those aren't even in the running. You really need something that, it costs a lot, and you don't eat a lot of it either because it costs a lot.
Yeah. And, and it's so filling. Like, if you get some kind of like a nice Swiss chocolate, like Lindt or something, and you get like a 91% chocolate, you just have one bite of it, and you're like, okay, I'm happy. I'm satisfied.
Yeah.
So that's actually my secret cheat is I always have a bar of dark chocolate in my freezer.
Yeah. And when you have a sweet tooth, you have a square of it, and it's great.
So a lot of times I'm done eating my meal, and I even had a big dinner, and I still feel like I need something sweet. What is that?
I mean, it's different things for different people. So for some people, it's that their blood sugar is not balanced. When your blood sugar is out of balance, and you get reactive hypoglycemia, which means you eat and your blood sugar gets absorbed really fast and it drops. For somebody that has a poor diet and poor blood sugar control, then that can happen. So yeah, it could be all about blood sugar. If you have general good blood sugar control, it might just be a habit too.
Yeah, it definitely could be a habit. One thing that helps me, I've noticed, at least in my own personal experimentation, is if I have enough healthy fat with my meal, I don't crave it.
Yes.
But for example, last night we had ribs, really good Southern style ribs, but not that much fat. In general, it was, we had some veggies, these great ribs, but I think it's also because these ribs had a lot of sugar on there.
Yeah. So it triggers that.
It triggered that. Yeah, I think that's what it was. So when I went home, I was like really just poking around for, for sweets.
Yep.
And the way that I stopped it was I had a little bit of dark chocolate and I had a glass of coconut milk.
Yep.
And that helped.
Yeah, that's a really great point, is increasing your fats if you're having a lot of cravings is the way to go.
Okay, cool. So our last question from the viewers is from Larissa. She's from South Africa, and she asks, "What supplements should I be supplementing?"
Yeah, so I would say in general, a lot of supplements are garbage. And one of the reasons why is that, people won't even think twice about going into a 7-Eleven or a Walgreens or a Walmart and picking up a supplement, but they wouldn't even imagine buying their food there because it's not very healthy. But you really want to put the same amount of effort into buying your supplements as you would buying your food, because supplements are, like I said before, only supplemental to a really good diet. So really with supplements, it's the same thing as we were talking about, is you really want high quality and less. A lot of people will just accumulate all these supplements because there's a never ending, supply of, oh, this would help me and this would help me and this would help me. But really you want to narrow it down to the few things that you need for your health and your body and your future, and get really high quality.
And is that different for everyone?
It's different for everybody. And that's why you would do something like track your blood work over the long term, because what your health needs are different than what my health needs are. And so there's not just a one size fits all, oh, everyone just needs to take this one thing and everything will be great.
All right. So before I came out, half my luggage were supplements. And I've recently given them all away. So a couple of things that I stopped taking is my multivitamin. I've heard a lot of controversy that, you either just pee it all out or it's not, really necessary anyways.
Yeah.
So with my balanced diet, real food, do I need a multivitamin?
No, absolutely not.
Okay. Next is fish oil. I've heard it's such a good, omega-3s are so good for you, and it helps lower your inflammation, helps balance you, helps lubricate your joints, all these great things about it. So I went out and bought 400 pills of fish oil from Costco, and but I've recently stopped taking it as well. What are your thoughts on that?
There's some supplements you can get away with taking lower quality, like when you need the quick boost of vitamin C and all you have available to you is 7-Eleven. Totally fine. But with fish oil, I would never ever take a poor quality fish oil because supplements are not regulated like drugs are. So whatever is on the label is not always, it doesn't have to be in the bottle. So you never want to take something that is not a really good trusted source for fish oil because it can contain a lot of contaminants and mercury, and the oils can be rancid, which would be kind of counterproductive to taking fish oil in the first place. It could actually end up hurting your health. So if you're going to take a fish oil, which all the things you said are true. It's really great for inflammation, lubricating your joints. It's one of those things that I think, on average, people need more omega-3 fatty acids. So it's a good thing to take. But you really want to take a good brand and a good source. And a couple that I like that you can find on the grocery store shelf are Nordic Naturals is a really good trusted brand, and then Carlson's. Those two brands are trusted. They have very high quality supplements. They're expensive. You pay for it, but it's worth it if you need something like fish oil. And if you're not eating seafood at least 2 or 3 times a week, then it's possible you might need some fish oil. Okay.
Is there any other type of omega-3 like fat that I can get from my diet? Let's say from my avocado or from...
Oh yeah, for sure. Anything that, especially animal proteins. If you're eating good grass-fed, good quality animal protein, then you will get good source of omega-3s from your avocados. You'll also get it, and other fats and oils like olive oil and things like that. You'll get a good balance of healthy omega fats.
Okay. What about coconut oil?
Coconut oil is, I forget the actual composition, if it's of 3, 6, and 9, but yeah, it gives you a very good high quality fat that's a fast energy source for the liver. Okay.
So, ideally you would be eating, wild caught, uncontaminated fish and fatty fish.
Exactly.
A second best scenario is you're eating, you're supplementing with a trusted brand of omega-3 oil. Mm-hmm. And then third would be, you eat a lot of avocado, a lot of grass-fed meat, grass-fed butter. And that, it's crazy that you never hear about, about beef being a source of omega-3s. And it's because the beef that we eat that's corn-fed, which is almost all the beef in the U.S. and all the beef everywhere, that has no omega-3s in it.
Yeah, the ratio of omega-3 to omega-6 or the ratio of omega-6 to 3 in our diet should be more like 1-to-1, but the typical American diet, it's more like 50-to-1, and so we get a lot more of the omega-6 from animals eating foods they were never intended to eat in the first place.
So the grass-fed butter, good call?
Definitely a good call.
Okay, awesome. So the last question, eggs. How many whole eggs, can I eat a day?
So an average egg has about 6 to 7 grams of protein, depending on how big it is. I think it depends on what your goal is. Is it okay to eat 2 eggs every day? Yes, for breakfast, totally fine. It's not going to raise your cholesterol. It's, really good for your health, a good source of choline. If you are trying to bulk up and I think you can eat more eggs than that and be all right. If there's an upper limit, I don't know. I think with looking at your labs, I would say maybe you don't want to do a dozen raw eggs a day. I would say for you, 2 to 4 eggs would be a better kind of, amount. If you are somebody who follows a vegetarian diet, then because, maybe you don't eat fish, but you do eat eggs, then I would say your need for eggs are going to be pretty high and you're going to need to eat them at least 2 to 3 times a day. So yeah, it kind of depends on what your goal is.
Awesome. And the bonus question is for the fruitarians out there. Is that a healthy diet?
So yeah, fructose definitely can wreak havoc on your health, and it will show in your labs when you get them done. It's just it's a lot of sugar, and a lot of fruitarians will drink a lot of juice. And there's nowhere in nature where fructose appears without fiber. And so whenever you eat a piece of fruit, you're getting fructose and fiber together, and fructose by itself without fiber is very toxic to the liver, just like alcohol. So if you're drinking a bunch of juice, which a lot of people that just live on fruit just drink tons of smoothies and juices, then you're probably wreaking havoc on your liver.
Okay. But if someone's eating a whole apple, is that okay?
Totally fine.
Okay. But if I wanted to, let's say, not eat that much fruit because I want to continue losing body fat. Can I get the same vitamins and nutrients from vegetables as I can from fruit?
Oh, absolutely. Yeah. Any leafy green, brightly colored vegetable is going to have tons of nutrients in it, just like fruit.
Okay. So if I ate enough, good vegetables, green leafy vegetables, and I didn't eat any fruit at all, would I be okay?
Yes, you'll get plenty of vitamin C as well.
Okay, awesome. Well, thank you so much for being on the show. I mean, this hour has been some of the best knowledge I've ever gotten, and I wish that I would have learned this in school. I wish that my doctors back home would have known this. And unfortunately, doctors that are studying ER are great at fixing your leg if it's broken, but they don't actually sit down and learn this stuff.
No, they don't learn a lot of nutrition because they don't have the time for it, and they're focusing on fixing you when you're in a car accident, and they're really great at emergency medicine, but naturopathic doctors are really good at preventing chronic illnesses and optimizing your health and your fitness, and that's kind of the areas that we shine. Yeah,
and you are fantastic. I highly recommend every single person do a 1 hour Skype with you and do these lab tests. And it's actually very affordable in the big picture, because what's not affordable is long-term chronic illness.
Yeah.
All right. So what's your website again?
It's Dr. Dr. Alexis, Alexis, Shields, SHIELDS.com.
So you can either go to dralexisshields.com or just come to Travel Like a Boss podcast, episode 18, and all the information is going to be there, including some of the lab tips results, the show notes, what you should get tested for, and the website. So peace out, guys. Good health, and hopefully I'll see you guys pretty soon. Thank you for listening to episode 18 of the Travel Like a Boss podcast. If you enjoyed this episode, please share it with your friends on Facebook and Twitter. And if you really want to show your support for the show, please leave a 5-star review on the iTunes store. It helps more than you know, and we really, really appreciate it. Take care, guys, and check out travellikeabosspodcast.com.